This video is for general information only and is not a substitute for medical advice. Always speak to your GP, diabetes team, or pharmacist before starting, stopping, or changing any medicine. So, how do clinicians decide what dose of a GLP-1 medication is right for you? It's a question a lot of people have, and the honest answer might surprise you. There isn't a single correct dose. It's entirely personalized. Let's talk through why. GLP-1 receptor agonists are becoming increasingly common in the UK, used to manage type 2 diabetes and in some cases obesity. There are several different medications in this class. You might have heard of semaglutide, sold as Ozempic, Wegovy, or Rybelsus, as well as dulaglutide, known as Trulicity, and liraglutide, known as Victoza or Saxenda. Some are injected weekly, some daily, and semaglutide is also available as a daily oral tablet. These medications work by mimicking a hormone your intestine naturally produces. That hormone helps regulate blood sugar and appetite. Specifically, GLP-1 medications encourage your pancreas to release insulin when blood glucose rises, reduce the amount of glucose your liver produces, slow down how quickly food leaves your stomach, and act on the brain to reduce hunger. That combination of effects is why they're used for both blood sugar control and weight management. Now, here's something really important to understand about how dosing works. Every GLP-1 medication follows a dose escalation protocol. That means you always start on a low dose and your prescriber gradually increases it over several weeks, as advised by your clinician. This is specifically designed to reduce gastrointestinal side effects like nausea and vomiting, which are more likely if the dose goes up too quickly. Your GP or diabetes specialist will determine the right dose for you based on a full clinical assessment, things like your HbA1c levels, your body weight, how well your kidneys are functioning, any other medications you're taking, and how well you're tolerating the treatment. It's a genuinely personalised decision guided by NICE recommendations here in the UK. On that note, for people using GLP-1 medications as part of a type 2 diabetes care pathway, NICE guidance recommends continuing therapy only if there's a meaningful response at 6 months. Your healthcare team will assess this and discuss what it means for you. A few other things worth knowing: if you're experiencing side effects that feel difficult to manage, don't just push through. Speak to your healthcare professional because there may be options to adjust the approach. If you're of childbearing age, GLP-1 medications are not recommended during pregnancy or breastfeeding, so do discuss contraception and family planning with your team before starting or continuing treatment. And if you're taking insulin or a sulfonylurea alongside a GLP-1 medication, your risk of low blood sugar may be higher. Another reason to keep your healthcare team informed. On safety, never adjust your dose on your own. Contact your GP if you experience persistent abdominal pain, repeated vomiting, symptoms that could suggest low blood sugar, such as shakiness, sweating, or confusion, or any changes to your vision. These are signs you need to be assessed promptly. In the UK, you can also call 111 for non-urgent concerns or 999 in an emergency. So to recap, GLP-1 medications work through several mechanisms to help manage blood sugar and appetite. Dosing is always gradual and always personalised. Your prescriber will determine the right schedule based on your individual health, and you should never adjust your dose without speaking to a healthcare professional first. If you found this helpful, give it a like and subscribe to Bolt for more medically reviewed health information. And if you have questions, drop them in the comments, though please don't share or request specific dosing amounts there, as your prescriber is the right person to advise on that.